I'm Dr. Edward Laniewski, board-certified orthopedic surgeon in Brighton, Michigan. I've been involved in cell-based therapy since 2005 and have done over 4,000 of these procedures. I've had the wonderful opportunity of getting to know some of the best researchers, some of the best patients, some of the best people involved in cell-based therapy since 2005. And I'd like to share that with you so that you can understand where we were, where we are now, and where we're going. So join us in Profiles of Cellular Healing. This is Dr. Edward Laniewski from cellularhealing.net, and I'm here with Profiles in Cellular Healing with a great interview that we're going to talk about Jesse Hatgis, Dr. Jesse Hatgis. He is not only in Phoenix, but he's also in Miami. And he specializes in pain management in really difficult cases. And he's going to go ahead and share his story with us. And then we wait a little bit and then, okay. Well, welcome back. We have Dr. Jesse Hatgis here. That is right now in Phoenix, Arizona, where it's about 110, but it's a dry heat.
Dry heat, no humidity. So that part is great.
And then you go to Miami where it's 110 and 100% humidity.
Flip-flop.
And Dr. Hatgis is a fellow DO. We give our little sign there. And he's double board certified. This will give him a very unique perspective on cell-based therapy, where he's not only board certified in pain management, but also in physical medicine and rehab, somebody we call a physiatrist, not a psychiatrist, but sometimes you may feel that way, but a physiatrist. And he's really dedicated his life to a very difficult area that we should probably dig into a little bit more, because this is something that some physicians just don't want to deal with. But you went ahead out of your way and want to deal with this. Patients that have post-traumatic stress disorder, which is sometimes poorly understood. And you have some great techniques that have been working well. Not only are you double board certified, but you've been the course director for the American Osteopathic College of Physical Medicine Rehab. You're also in practice at the Phoenician Neurologic and Pain Institute that's in Phoenix. And you got to tell me the name of the place in Miami that you are also at.
So the place in Miami is called PTSD Group, all kind of one word, and it's right in the heart of the city of Miami.
Excellent. So I don't want to go ahead and monopolize this because you got a lot to say here. So Jesse, why don't you tell us a little bit about yourself, how you even got interested, how this became your passion to go ahead and treat this terrible chronic pain syndrome?
So we were discussing before kind of each other's backgrounds, and I'm from Long Island, New York, and I was actually in high school when 9/11 happened. And luckily, I didn't have anybody in my direct family or my close-knit friends who was directly affected by 9/11 in terms of family members or people who died. But I had a lot of friends and a lot of people who either were directly affected or friends of mine years later who served in either fire department or NYPD, unfortunately were affected and died secondary to chemical and smoke exposures due to this. And you can see the torment in them and their families is secondary to this. And that really always stuck with me. And as I mentioned, I was in high school, and Long Island is directly east of Manhattan. And the jet stream that took all the smoke, from one side, going eastbound, was directly over my high school. Wow. So I remember for about a week, I wasn't able to go outside at all. I basically have to run from building to building. My high school was on a campus. So we'd have to go from one class to the other, and it was a nightmare. I mean, you were literally smelling, without getting too graphic, the stench of rotting bodies and metal from the buildings and such. And, I can still smell it to this day. It was a little bit dramatic for me even experiencing that, being involved with it. So that was always something that stuck with me, being able to one day serve our police department, fire department people, expanding this out to, veterans as well of the armed forces. And, we really took this upon ourselves. I'm partnered with a couple other people in this, and we all have some sort of connection to either 9/11 or people with PTSD of various forms. We've even treated our own family members with this technique, which is the stellate ganglion block. And there was actually an interesting piece on this maybe about 2 months ago from some people who were doing this on a couple of veterans in the Northeast. And it's become quite a hot topic, especially since so many people, both famous and non-famous, are unfortunately succumbing to the effects of mental health and committing suicide from all the devastating things that could occur from PTSD and anxiety. So it's really something that, I've taken very personally to try to help people, overcome this in the way that I best can do it.
Well, Jesse, that is interesting. We have some people that are watching right now that may not know about what stellate ganglion block is, but in layman's terms, go ahead and tell us what that is and why it works.
So the stellate ganglion block is performed right above the collarbone, so maybe about right here if you can see it on the screen. And it's a little injection that we use local anesthetic or numbing medicine, just like if you were to go to the dentist and get a shot of Novocaine for your tooth to numb it. That's essentially what we're using in the neck. And we use image guidance, meaning that either an ultrasound machine or an X-ray tube could be used to localize exactly where that needle is going. And it's going in a very specific spot of the neck called the stellate ganglion. And the stellate ganglion essentially connects directly to brain structures that are impacted through emotional memory. So there's structures such as the amygdala, the hippocampus, the internal limb of the capsule, and a few others, which I won't bore you with too much, that are directly involved with processing the emotion that is associated with traumatic events or memories. And what happens is when we block that stellate ganglion, we are resetting this system, which is essentially the sympathetic nervous system, or what's known in layman's terms as the fight or flight system, which is thought to be overactivated in patients who do unfortunately have PTSD. And you can see this in terms of having difficulty concentrating, perseverating on events of the past, developing panic attacks from rethinking these events or being placed in traumatic situations. Most people who are watching this now probably know somebody or could relate in some way to somebody who does have PTSD, whether they know it or not.
So, Jesse, it's kind of like this. You have a certain system in your body. Some people call it like the sympathetic or the parasympathetic, the fight or flight, that gets turned on, and it just can't get turned up. You just can't turn it off. And what you do is you kind of hit the circuit breaker and shut that off, and then allow it to restart so that they can start living a normal life.
Absolutely.
And patients have gone through this, and you've seen numerous of them. I've seen some myself because I specialized in revision total joints, where people would have a joint replacement surgery and then have this terrible pain afterwards, a traumatic event. And soon as you went ahead and did this, it was like their whole face and their whole body just totally changed. And it's just amazing because you're just like resetting it, and then they feel better. Now, sometimes it's not permanent, but at least gives you an idea that is exactly what's bothering them, and they are so grateful that gets turned off. So I applaud you on doing that, especially in a lot of patients that have post-traumatic stress disorder, which is really quite prevalent. So tell me a little bit about some of let's say, a good personal story of somebody that you've treated. Obviously, don't use their name, but somebody that you've treated that really affected you and made you think that this is the right pathway.
So it's hard to place just one example, because really everybody that we've done has really stuck out in my mind as being special. I could give maybe a couple or several examples to kind of see a variety of it. The first person that I treated doing this for this specific indication was actually, it was a family member of a doctor friend of mine who's involved with this as well. And essentially this gentleman was in his mid to upper 20s. He pretty much had everything going for him in his life. He was doing some sort of work. I forget what his occupation was specifically, but he was moving up the ladder, doing very well. And all of a sudden, he got into a horrific car accident, which probably most people would have, died from, but he survived. And unfortunately, throughout this process, he sustained many both visible and non-visible wounds from this. Had multiple surgeries, was laid up in the hospital for, I believe, several months, got out of it, and he was not really able to drive again, whether he was a passenger or in actually the driver's seat. Any little non-perfect thing in terms of traffic would just get him going. In addition to having issues with personal relationships, like he would always lash out for really no reason at his family, whether it was his girlfriend, his mother. Just his life was going down the tubes. He couldn't.
And chronic pain does that for you. Chronic pain makes you do things that you really don't want to do.
Absolutely. So not even just the chronic pain in terms of the body, but just up here mentally, he was not able to focus, not able to really put new memories into his brain. It was just a mess overall. And I had the pleasure of meeting him before the injection, and I believe we even had some breakfast prior to doing that. And you could just see, I mean, I'm a relatively empathetic person, and I was just feeling like I myself was becoming super anxious from it because of kind of what energy he was giving off. It was it very much affected me. And I thought, like, wow, if I'm feeling this and I'm not inside this person's body, I can't imagine what he's actually going through every day. It was very touching to a degree. So essentially what we did, we got him on the table after, we calmed him down. He was actually going through a panic attack during the procedure. He was that, anxious about it. We did the procedure. It took about a minute to do. I wasn't even done injecting the medication, and before he was, really just going through this panic attack, and you could see all of a sudden he just, like gave this
deep sigh
of relief, and he was very anxious before. He would talk in a way like he was rushing to finish his sentences, and afterwards, once we did that, he says, "My panic attack just went away." Oh my God. And he started laughing, but he had this, like, it came from his soul. It came from like his belly, this laugh that he had. And it was just this emotional release that he had that you could tell, like, it was just like these years of holding back, essentially, that just kind of like came out of his pores, so to speak. And it was exhilarating for me to even experience this. I can't even imagine how exactly he felt while doing this. But since then, he's been good. And we probably did him, trying to think, probably about 9 or 10 months ago at least, we did him. And he's been good ever since. Now, of course, there's the everyday stresses that he may be going through, just like working, just like having family life. People are giving him things that maybe, are difficult for anybody to take throughout daily life. Maybe certain things annoy you. He's going through that, but he's having a normal emotional reaction to going through that rather than having an extremely exaggerated response, and he knows the difference at this point.
Yeah.
So it's been fantastic in terms of what, he was expecting and what the actual results were. So that, was one that really stuck with me because that was really the first time I got to do this for somebody who, was suffering that way. And there's been so many others that we've done. Obviously, not just for car accidents, we've done many different veterans, firefighters, police officers, people who were unfortunately raped, verbally or physically abused, had other sort of traumatic events. We're going to probably be doing a few people that were involved with some of the school shootings that happened in Florida as well.
Yeah.
Within the next few weeks. Whatever, sort of trauma there is, PTSD doesn't discriminate. So it really doesn't matter whether you did 4 tours in Iraq or you unfortunately were raped. That pathway is really the same. And I think we found a great way to actually treat this in a very quick, very non-invasive manner, which, you don't really have side effects from this. This is very basic. If done by, an appropriate board-certified physician, this is a very easy technique for them to do, especially somebody like me or, a surgeon who does stuff like spinal cord stimulators or things that are way more advanced of a procedure than this. This is pretty basic to do for someone with proper training.
And it's just one treatment there. They notice it right away. How long do you think that most of your patients, they get that benefit from it?
The majority of them have not had to come back. We've gotten a few that say, you know what, I noticed that maybe I'm still 80 or 70% good, but I start to see it coming back. And they say, I want to treat this again to do a repeat sooner rather than later. And they're always welcome to do that. Another thing within our protocol that we actually have done is it's about an 80 to 85% success rate on the first injection. We basically have a second spot that we figured out how to utilize, which is different than the traditional C6 location that we've been utilizing as well. And that itself has been having about a 90% success rate in those who didn't have the initial shot work for them. And we do that all on the same day. So, we have certain patients who basically we ask them, of course, after the procedure, we give them about a half hour if it's not immediate, and we say, how are you doing? How are you feeling? And they say, well, not really seeing much of a difference yet, or I feel a little bit of a difference, but I don't know. It's not exactly what I expected. And I said, okay, we're going to do a second block. We'll get on the table again and do that. And we do the second block, and it's a definitive difference where they say, that was what I was looking for.
Good.
That's what it was. So that's typically been our reaction. I think
you get immediate feedback, unlike some of the things that we do in orthopedics. We'll say, well, we'll see in 6 weeks. So this is very gratifying for you and for patients that they can notice right away that they have these things. Going on to with these, this is, you're literally like a godsend to some of these patients here that have been searching and doing a lot of other things. And talk about other things. Where do you see the role of regenerative medicine and things like platelet-rich plasma or bone marrow-derived stem cell treatment? I noticed that you just did a little segment, I think, on your local TV station about that. So why don't you go ahead and tell us about how maybe some other types of treatments may play a role in this?
Sure. So I think, regenerative medicine has been very hot for the last few decades, but due to a lot of restrictions, whether it be FDA or even just financially for patients to front, money for this procedure to have done because it's really not approved by the majority of insurance plans. Patients are essentially relegated, at least in terms of pain, for utilizing steroid injections or resorting to, relatively invasive surgical means to have their pain managed properly. And the evidence honestly isn't great for most orthopedic surgeries, especially in the spine, which is my main forte.
Yeah.
Not everybody is a candidate to undergo a 4-level fusion because they have back pain. So for me to do something where maybe we could inject some of the facet joints with some PRP or stem cell, or do something where we could essentially use a very non-invasive technique with the patient's own body parts essentially to heal it, I mean, makes sense to me to do, prior to doing something where you're essentially splaying open the spine and putting in just metal rods and bolts and all these other sorts
And
of.
it kind of fits into your philosophy as a DO, you know, to do no harm and use the body's own ability to heal itself. And so that kind of makes sense.
100%.
Yeah. I hope you're liking Profiles in Cellular Healing. If you do like us on Facebook, or if you have a question, go ahead and give us a question. We'll be more than happy to answer them for you. Because remember, these are your cells for your healing. And you again, you're dual board certified. You're at the Phoenician Neurologic Pain Institute in Phoenix. You can look him up online. He's got a whole bunch of videos out there that really focus in on that ganglion block that you do. And it looks like you're doing it in a compassionate manner. And talking about a compassionate manner, you did kind of go over about some of the regenerative medicine techniques that do work. Maybe not have a role with the ganglion block, but other things, like you said, like facet blocks, which is actually the joint of your spine that might be bothering you. We do a lot of this for like joints of your knee or hip or your ankle or your shoulder that tend to work quite well. And there is fairly good, significant comparative evidence that it does better than most of the traditional treatments that we have. But you touched on something that can be used in patients that may not have the financial wherewithal to afford that. And that's not right. You know, we both went to medical school not to segregate patients, but to deliver medical treatment to everybody. And it's unfortunate when there is something that you know may work, but you can't get it to them. Have you had that experience where you know that this is going to work for somebody, but they just can't afford it?
Probably every hour of every day that I'm in clinic, there's somebody that I'm thinking would perhaps, benefit from utilizing either PRP or stem cell for the variety of reasons you mentioned or touched upon. And to me, I know it's just not feasible for the patients. And a lot of times I ask them, and it's a somewhat awkward conversation to have with them as well, too, because you never really want to pry into somebody's financial life. But these are procedures that do cost money that, are out of the realm of insurance covering it for at least now. And really, it's an awkward conversation, and I feel it's awkward for me because if I essentially let patients know that maybe there is something out there that could be done, and they get their hopes up, and then they ask me how much money is it going to be, and I tell them, and they say that's not going to happen because they can barely even afford to buy dinner that evening. How are they going to afford, a PRP or stem cell procedure that, is not 100%, slated to work or be 100% effective? So to them, justifying even being able to spend that amount of money for them, it's a rough decision for them to make, and they usually, err on the side of financial caution and don't do anything. So I think in most patient populations, it's kind of rough. And unfortunately that, we do, even in my practice, we don't treat enough people that would perhaps benefit from this. And, it definitely takes a network. It takes a lot of really good marketing. It takes a lot of different things to develop a practice, I'm sure, such as yours, that is really dedicated to doing this and having it as a majority of what you actually do as part of your practice.
Yeah. And like I say all the time, and we have lots of videos about, these are your cells for your healing. These cells should be for everybody. They're your own. You should be able to use them. And then I think in this part of the development of the natural history of regenerative medicine, we're very similar to what the early days of the auto industry were. So REOs had the best car available. That was the REO Speedwagon that was also a name of a band in the 80s.
Right.
But nobody could afford it. It was over $1,800. And that was somebody's whole salary at that time. But Henry Ford was able to get it to everybody by developing a Model T, something that wasn't the best car, but got the job done in a safe manner so that everybody could afford it. Now, if we also look at, think about LASIK surgery. I just heard the other day an ad for $250 an eye.
Oh, wow.
Now, why is that? I think the reason is that insurance didn't cover it, but the public wanted it. So they demanded it at a lower price with better results. So you remember when LASIK came out, it was like $5,000, 70% success rate. Now it's $250 an eye and over a 90% success rate. Why? Because the natural market forces force us, the medical community, to come up with a better product. And maybe that's what they're doing right now. And I think we're getting there. We're getting there where we can get this into that under $1,000 range to get somebody a very good, safe, effective treatment using their own cells, which they should be able to do. And I feel bad for you that you have that thing pulling you apart, that you want to give it to them, but they can't afford it. And we're trying to also raise that in a 501c3 to raise money to be able to give that to people, especially here in Detroit, where I was born and raised. There's areas there that are just totally devastated, and I have patients that come out to me all the time, and we just treat them for free. But you can't do that for everybody. I mean, you can't keep your doors open. You wish you could.
Right.
But I see where you're coming from, and I really salute you in taking that step to treat these very difficult patients. Because I have very many colleagues that were like, they don't want to touch this. They don't even come close to it. They'll make fun of them. They don't need to be made fun of. They need to be taken care of, and you're the right person to do that. And while we're talking about that, what do you think it is that drives you to be able to take care of these very difficult patients that are in terrible pain and have a real problem? What's that thing inside you that drove you towards this? I know you told about your story, but there's something a little bit more there.
I think it's...
Oh, is that a cat that you got?
Chihuahua.
Oh, it's a Chihuahua.
Quiet. He's been doing well, though. Look, the size of a cat, probably smaller in weight, if anything. But,
you're like Dr. Evil. You're petting your cat while you're there. Yes.
I was doing the little head strokes.
Okay.
But, in any event, I forgot what your question was.
Oh, the thing is, yeah, I was getting at that. There's something else inside you that drives you to treat these patients, and I want to know what that thing is.
Sure. So basically, I was an athlete growing up. I've had my fair share of injuries. Fortunately, I was able to keep it as an acute pain and not have it where it's been bothering me significantly for the rest of my life to have something impact me in that way. But I've seen it. I've seen it in friends. I've seen it in family members. And even just patients, you can really see how hard they're actually trying to get better. And they just can't, break out of it. And, it says the body affects the mind affects the body, right? It's just something that really is so difficult to deal with.
Well, there's one more part of that too.
What's that?
There's one more part about there's the mind, body, and spirit. There's three things there that actually,
right.
and you touched on that, where that gentleman that you treated, you could actually have that guttural laugh that came right from his soul, that gets affected too.
Right. So I really feel for these people, and it stinks having to go through, pain every day of your life, and it's going to affect your quality of life with your family. It's going to affect your job status. It's going to affect even just being able to do simple things like sleep or eat, or being able to go to a national park and walk more than half a mile. I mean, there's just a lot that's affected by it. So as somebody like myself, like I mentioned, I was an athlete. I believe in function, and to see these people not being able to even function in a basic capacity is a huge strain, not only on their lives, but on the healthcare dollar as well. So, I was equipped essentially and blessed to have had the training that I have had, starting from, college through medical school, all the way throughout, my fellowship and even beyond that, because we're learning every day as physicians, no matter how long we've been doing this. And it's really something that, I take pride in. And whenever somebody, does thank me, or I could see in their eyes that they have gotten better, it's a blessing. I don't think, you really have that in many other professions. And even within medicine, there's not too many other, specialties or subspecialties where you really get that exact gratitude in that specific way, where you can really see their functioning just go up from there.
Yeah.
From having treat something like that.
And you're adhering to the basic philosophy of being a good osteopath, is that you're relieving pain, you're restoring function, and you're doing no harm.
Right.
Most of these treatments that you're doing right now, the complication rate is extremely low. You don't get addicted to a stellate ganglion block. You don't get addicted to PRP. So this fits that whole philosophy, and it makes you not only function well, think well, but just be a good human being again. Because a lot of people that you see, look at the NFL and all these guys that are they're great role models until they get, the trauma, the closed head trauma, and they're like, what the heck is that guy thinking? Well, he's not thinking, because he can't think right anymore. And so they do really dumb stuff, and it's not them, it's their disease, and you're helping to treat that disease. And I take my hat off to you. So we're right at the end here again. We got Dr. Jesse Hatgis, just like batten down the hatches. He's at the Phoenician Neurologic and Pain Institute in Phoenix, and he's also takes some of his time. He goes back down to Miami. He treats patients there. He's a good guy. He's trying to do the right thing, and it's just one more piece in this puzzle of regenerative medicine and taking care of pain without any side effects. So, Jesse, thank you for being with us. God bless you. I hope to meet you again soon. And again, if you want to get in touch with him, the Phoenician Neurologic and Pain Institute in Phoenix, Arizona, where it's a comfortable 110 in the shade. It's been a great time, Jesse. Take care.
Thank you very much. Thanks for having me. I really appreciated your time, and I enjoyed our conversation.
I did too. Thanks for joining us on Profiles in Cellular Healing. Don't forget to go ahead and like us on Facebook or subscribe to us on YouTube. Or you can go ahead and contact us through cellularhealing.net. Remember, these are your cells for your healing.